I can just share with you that Stanford is an amazing place. It's in our community, and it's forward-thinking. The medical school is currently undergoing a major renovation, the Li Ka-shing Center. They had groundbreaking just a few weeks ago. The entire basement level of that facility will be dedicated to immersive learning, simulation, and a place for standardized patients. So this is something that is becoming more common in medical schools and med centers across the country, but Stanford is clearly leading as, in this particular area. So we take on these complex tasks. We do it in a safe environment. Let me give you one more example that intubating patients is something that anesthesiologists or emergency care clinicians have to do. I would hope that they have their first experience doing this with a robot mannequin, because if you don't get it right, you can at least talk about it later. There's a safe environment where you're allowed to make mistakes, to perhaps not do it in the correct sequence or get the order right or do it quickly enough, but there's no one that gets hurt. And so as a learning environment, it's a great way to get up the learning curve. I don't think we're ever going to replace the mentor and apprentice program with a senior attending physician guiding medical students through the process. But at least this is a way of getting them up the curve so that they can do it in a safe way. So that's the end of my presentation. I'll wait for questions at the end.
Listening to Evan reminds me that I get from time to time some interesting phone calls in my role at the hospital. And one day I picked up the phone and a gentleman on the other end said, "Hi, I'm an actor visiting in your area from Los Angeles, and I'd like to know if you hire actors at the hospital." And at the time, I just thought this was really odd and strange and unusual, and I told him that I was sorry, but I didn't think we hired actors at the hospital. But now that I know what Evan and his colleagues are up to in the simulation center, the next time somebody calls and says they're an actor, at least I'll know where I should be sending them.